Title page. White writing against a blue background reading Medical Transition, Tips by and for Trans, Non-Binary and Intersex People. Below is a drawing of a hospital with two green trees on either side. In the bottom left, there is the Clare Project logo with the subtitle Supporting Trans Communities, Campaigning for Inclusion. Page 1. Title: What is a medical transition? Medical transition is a process some transgender, non-binary and intersex, TNBI, people go through of changing our biological sex traits, our hormones and body parts, to those more in line with how we feel and how we present our gender. For example, someone who is assigned male at birth but who identifies as a transgender woman might take estrogen, a feminizing hormone, to promote breast growth. This booklet is written by and for TNBI people who are interested in or going through a medical transition and for the people supporting them. In the bottom right-hand corner, we have a picture of a community member in a white t-shirt and blue jeans who is in a wheelchair, with a quote saying, "Remember that medical transition is only a tiny part of most TNBI people's transition journey. The social transition, changing your name, your clothing, your hair, and the emotional journey you go through on the inside, those are the larger parts." Page 2. Title: Making the Decision. Deciding to permanently alter our bodies is a big decision. Not every trans or non-binary person will want to do it, which is totally valid. You don't need to medically change your body to really be trans. You don't need surgery to be a real man or woman. Many intersex people will not want to medically transition either, for similar reasons or because they are cisgender, comfortable with the gender identity they were assigned at birth. If you do decide you want to medically transition, there is a standard NHS pathway in the UK that you can take. In the bottom left of this page, there is a drawing of a community member in an orange t-shirt, blue jeans, with a walking aid, with the quotes, "We have listed lots of options here, but if you don't want all of them, that does not invalidate your transition. You know your body and what you want best. Transition doesn't have to be frightening. It's not all about genitals. It's about finding congruence and harmony." Page 3. Title: Talking to the GP. The first step for anyone interested in a medical transition is to go and talk to their GP. If you don't know what to say, write a list before you go, or take a friend, family member, a support worker, or an advocate with you to your appointment. If you wanted to, you could also show your GP the next page of this booklet to help them to know how to help you. Below the writing is a drawing of a GP waiting room with a screen saying MX Jones, room 7, 2 rows of seats, and a secretary at a desk with a laptop. Below is some tips. 1. If you want to try hormones or surgery, ask your GP for a referral to the Gender Identity Clinic, the GIC. 2. Before starting a treatment, always ask what changes are reversible and which are irreversible. Page 4. Title: Advice for GPs. 3 bullet points. 1. Ask what steps your patient has already taken towards transition. 2. Refer them to their local gender identity clinic. There are 7 GICs nationally. You can usually find their referral forms on their websites. Be aware, waiting lists can be as long as 2 to 3 years. 3. Ask them about their mental health. Being trans is not a mental illness, but experiencing discrimination can trigger mental illness in trans people. A shocking 80% of trans people experience suicidal thoughts. Consider referring your patient for counselling if appropriate. Below is a drawing of a GP in a medical mask and blue medical scrubs. Next to it, a note on bridging. If your patient is self-medicating with hormones or is likely to, and you believe prescribing them hormones would reduce their risk of self-harm or suicide, you can consider prescribing bridging hormones whilst they wait to be seen by the GIC. For more guidance, go to the GMC website ethical guidance ethical hub trans healthcare, or ask for advice from your local GIC or endocrinologist. Page 5. Title: Hormones. Estrogen causes people who are born with more typical male biology to develop more typically female biological traits. These effects may be enhanced by taking treatments that block testosterone production. Trans feminine people who take these medications in the form of gel, patch, injection, or pill can expect some muscle fat redistribution, a small increase in breast tissue, and slowed growth of facial hair. A common side effect is a reduced sex drive, and you may have an increased risk of blood clots and liver problems. Below is a drawing of a community member in a purple jumper, grey trousers, pink shoes, and pearls, with the quotes, "Hormones are not going to work overnight. You are not going to wake up the next day with boobs or a beard. Be patient. Bodies take time to change. Most GPs won't prescribe any hormones until you are under a GIC and they have guidance." Page 6. Hormones continued. 3 quotes with a drawing of a community member in a red jumper, blue jeans, walking a dog. Quote, "For many trans people, taking hormones is for life. I still have to go to the GP and talk about my hormones, and I started 10 years ago. It can be tempting to try and take hormones before going to the doctor, but it can be ineffective or dangerous. You might go years with the wrong blood levels. It's worth thinking about storing your sperm or eggs before starting hormones." End of quotes. Testosterone causes people who were born with more typical female biology to develop more typically male biological traits. It can be taken as gel or as an injection. Transmasculine people who take testosterone may grow facial and body hair, their clitoris may enlarge, their voice may deepen, their periods may stop, and they may put on muscle. Common side effects include male pattern baldness, acne, and increased sex drive. You may also have an increased risk of polycythemia, thick blood. Page 7. Title: Feminizing Surgery. For trans feminine people, the following surgeries are available on the NHS. In list form: orchidectomy, the removal of the testes; penectomy, removal of the penis; vaginoplasty, construction of a vagina; vulvoplasty, labiaplasty, construction of labia; and clitoroplasty, construction of a clitoris. Below are anatomical before and after pictures of these surgeries when all done in one procedure. In the first picture, we see a penis, bladder, prostate, and testicles. In the second picture, we have the bladder, prostate, new clitoris, new labia, and new vagina. In this example, tissue from the penis or scrotum is used to create the new vagina. You can also have a surgery which uses part of the bowel instead. Look up different types of surgery before your appointment. Non-NHS surgeries include breast augmentation, facial, voice feminization, hair transplants, and more. Page 8. Title: Masculinizing Surgery. Transmasculine people can have chest reconstruction top surgery or genital bottom surgery. There are 4 chest reconstruction techniques to consider. Double incision, shown in picture A, inverted T, shown in picture B, are used for bigger chests. Keyhole, shown in picture C, periareola, picture D, are for smaller chests. The images show the scars left by each technique. The following NHS genital surgeries are available: metoidioplasty, which is maximizing length of the clitoris, is shown in the top image. Phalloplasty, which is construction of a penis, is shown in the bottom image. Note, these surgeries will affect sexual function differently. These can be with or without scrotoplasty, construction of a scrotum; urethroplasty, the construction of a pathway allowing standing to pee; and hysterectomy or vaginectomy, which is the removal of the womb or vagina. Page 9. Title: Final words. The page shows various pictures of TNBI models with quotes, but note, these quotes are from our community members, not the TNBI models pictured. If it's the right thing for you, you will be much happier. It's a wild ride, but it's one worth doing. It's really worth having a GP who understands gender issues. You could ask your friends or local trans community organizations if they know of anyone. Changing how you feel inside is more important than changing how others perceive you. I get to wear skinny jeans now, and it feels amazing. For people of color, look up whether or not your surgeon has experience working with your skin type. It can make a difference with nipple grafts, etc. I've also known I'm trans but was unsure what I could do or how I could do it. I came out at 33. No matter how old you are, don't live your life for others, live it for you. If you are intersex and trans, you may require different types of care because of variations in your hormones or anatomy. Page 10. Final words continued. This booklet was designed and produced by the Clare Project. This is the October 2020 edition. Booklet is available in other forms on request. Below is a drawing of Brighton Pier. Contact details. Address: The Clare Project, Dorset Gardens, Methodist Church, Dorset Gardens, Brighton, BN2 1RL. Email: info@clareproject.org.uk. Facebook: www.facebook.com/tcpbrighton. Twitter: twitter.com/theclareproject. Credits: Writing and design: Luca White, Ven Paldano, Danny Fowles, Isabel Thornton, and other members of Community Consultation Group. Images by James Fox, The Gender Spectrum Collection. Statistics: Jaya's Trans Mental Health Survey, 2012. Final page. White writing on a blue background with drawings of the 4 TNBI flags. The Clare Project began in 2000 when a group of trans women started meeting in the back room of a hairdressing salon to discuss issues affecting their local community. We are now a registered charity run by and for trans, non-binary and intersex (TNBI) people in Brighton, Hove and East Sussex. We have welcomed thousands of TNBI people through our doors, regardless of their gender identity or expression. We run support groups, information sessions, workshops and socials for local TNBI people, as well as providing information and training for individuals and organizations on TNBI community needs. Our contact details are on the last page of this booklet. Please get in touch with us for more information or to access our support. We are here for you. Below we have the Clare Project logo with the words "Supporting Trans Communities, Campaigning for Inclusion."